Hello, my name is Bridget from Malawi, and today, 28th February, is the last day of the application cycle for the Mentorship Career Development Scholarship that we're providing, myself in collaboration with Dr. Mary Mkandawire. And I just wanted to address a couple of questions that I've been hearing in my inbox and getting in my inbox. And I know very well that a lot of you maybe have the questions in your mind, but you're scared to ask the questions. So I'm just going to address the questions here. Hopefully that sort of encourages a number of you who were shy to apply. One of the things we know about women working in the health space and generally is that women will wait to achieve every single criterion before they apply for a job. That's part of the things that I'm hoping to mentor other people to do. Encourage yourself, fight through it, and still apply and ask the questions if you need to. So I'm just going to address the questions. Hopefully those of you who have responded to already have applied, but if others are still keen and interested in this opportunity, please just, take on board what the answers I'm going to give. So one of the things about the scholarship, what it is exactly, I think a lot of the questions are around what exactly is going to happen with the scholarship or what is this fellowship about. So it's an opportunity for yourself as a woman working in health or global health to engage with me. I know a lot of people reach out to me and sort of say, I want some mentorship and some guidance and to talk to you about my career. So this is just a structured way in which we can engage, and at least I'll be able to commit my time specifically, because sometimes it's just like random requests. So I wanted to be able to have a very specific group of people that I'm working with over the next month or so. Now it's actually in 3 parts. One part is that part which is the mentorship with myself. The next part is really exciting. This is how it actually gave me energy to put this together. Dr. Mary Mkandawire, life coach, is an amazing lady. She's also a medical doctor by training, but she's sort of pivoted her career to become a life coach. So that's how I met with her. She's been also like a coach through my in my life as well. So really exciting. She's created this online platform. So even for those of you who might not be interested in being mentored by me, but you were looking for an opportunity to just think about your career, you can actually apply directly to Mary's program, your next career move boot camp. It's so awesome. So it's a short course. You can take it you could really literally do it over a day if you wanted to. 5 modules. You can take them at your own pace. We're gonna let you do them for a month, just give you that space for a month to go over this course, but it's an online course. It's worth $50,000. The fun part is I'm going to pay for the 5 people that I'm going to support for this program. So basically it's an opportunity for you to go through specific guided modules to think about your career. Who's meant to apply for Mary's course? Anybody can apply. For the specific scholarship opportunity that I'm providing, I stipulated for people aged between 18 and 30. And this is one of the things I really want to encourage women to do. Ask the question. A lot of people inboxed me and said, you know what, I'm 31 tomorrow. What do I do? I said, apply anyway, because, the age restrictions for me were just like a guiding principle. So, sometimes, and I've seen a lot of people be able to do that, the gusto to say, you know what, I'm 31 or 32 or 33, and I just, I really think I want this opportunity and it's aligned to me. Write to us, apply, explain why you should get the scholarship, why you want to get this opportunity. That's part of what I'm trying to promote amongst our colleagues as well. So as I said, a lot of women, and I've been guilty of the same thing. I'll tell you one story. I once received, somebody's inboxed me an application for a role, and I looked at it and I was highlighting in yellow. I like to highlight. I highlighted all the requirements, right? All the minimum requirements that they wanted, all the qualifications they wanted. I highlighted every single one of the 19 lines that they had except one. Do you know what I did? I didn't apply because I wasn't able to meet just one of the 19. Studies have shown that men don't do that. Men will apply even if they only qualify for 5 or 6. I waited until I had all 19. And funny enough, the funny thing for me for that particular role was I didn't apply, but for some weird reason, because I'm often, God works in amazing ways, I bumped into the people who were doing this consulting request, and they were just like, you're perfect for this role. I got the role, and that talked to me that said the same thing, that apply anyway, ask the questions. If you want, and I've really appreciated the people who've inboxed me and said, you know what, I'm 30 or I'm not necessarily this, can I still apply? And most of them have said, yeah, just apply anyway. So just an encouraging thought that if you're, well, ideally you should be above 18, but if you're like above 18, 30, 31, just apply anyway. Ideally, the reason we put this age limit was actually because we were looking for emerging leaders, and we thought that between 18 and 30 would be the age where most people would be really starting to trying to get their career on place, and sometimes that's the age when you are trying to make your next career move. I remember I decided to go for my master's when I was around 30 something. So again, it's not necessarily like, you can't make career moves when you're in your 30s. It's just that we just put this age limit as a sort of it's not a must mandatory thing. So again, if you're a little bit above the age but you're interested in this opportunity, do apply. And then another question I've received a lot of, which makes me understand that sometimes language that we're using in the medical field and other fields can sometimes be exclusive or exclude others, the word global health. So I guess I'm a global health practitioner, public health by training. I'm a medical doctor, but it really is an opportunity for anybody working in the health space. Health, whether you're a lab tech or doing IT or science or anything, as long as it's aligned to health, that's what global health is about. In fact, global health is really about addressing the needs of populations and making sure there's equitable access to health. So whether you're doing research or whether you're doing like practice, whether you're a clinician or whether you're like a nurse or lab or pharmacy, for me, that's my understanding of global health. Therefore, it's not restricted to only people who are doing public health per se. If you're in a clinical area, but you're really interested in being mentored by me or be doing this course, I would encourage you to apply. And then the other question I think I've received a lot of is like, I think I've explained a little bit about what exactly this is, but then also what is required of you. So again, it really is an opportunity for yourself to interact with me. For those people who know of me or have heard of me, but sometimes might not feel comfortable to engage with me directly, this is an opportunity for you to talk to me about anything. So we'll have an opportunity. What we've committed to for this program is 3 mentorship sessions spread out across whenever you want them to be across the month that we'll be engaging. So again, we can have a discussion about what you want, where you want to go, whatnot. So that's what you can commit to. And then 2, again, you have to commit your time to this course, the online course that Mary has created. It's fantastic. We're paying for you to take this course. So, money's challenging now. So my thought was maybe let me help people, a few young people, again, young people who might be interested to be able to take on this course. And then finally, we also do want you to commit your time and airtime as well, obviously, because we're providing the scholarship to the course. We're also providing time, my time, and Dr. Mary's time as well. But one of the things I've also wanted people to learn is your own self-interest, your own investment in your time. I will tell you countless number of times that I have invested in myself. I want you to invest in yourself. There's an attitude of like, everybody should pay for me, and I'm supporting you by paying for this. We are supporting you by paying for the scholarship, by getting this opportunity, but I also want to develop in you an element of I'm investing in myself. So what you're going to invest is your time, your airtime, and bundles to participate in the course. But again, it's if you see it as a worthwhile investment for yourself and your career, this might be just the thing that will push you to the next edge, to wherever you want to go. And often I think sometimes what I found is, especially when you're finished school, sometimes when you're just doing school, I remember being in med school, I just wanted to finish med school. So I was just like, let me just get done with it. And then when I was done, it was just kind of like, okay, so what am I going to do? What way do I go next? So if you're in that place, or you're just really thinking through, or you want to have some structure, again, I've looked at Dr. Mary's course. It is fantastic. It's going to help you create a career plan. It's going to really explore your desires. And the reason why Dr. Mary is amazing is because she is, like myself, a bit of a unique fish. We're medical doctors, but we're not your typical medical doctors. So therefore, we're willing to challenge the status quo, to really challenge you to take yourself outside of the box that maybe sometimes our careers might sort of push us through. So we're team gusto for whoever wants to do something unique and exciting for themselves. And if you're that kind of lady working in Malawi in health, in whatever career or profession, we're looking forward for you to join. Last day is today. the application is not very hard. Your name, your email address, your phone number, a little bit of a 250 words essay just to explain your career goals, and also just to explain like why you want to take part. But I hope this FAQ has addressed some of the key questions that you may have had. I look forward to seeing many of you on the course, and yeah, so looking forward to seeing you and helping you on your next career move. Thank you and all the best.